Pencil beam scanning is a new technology how to deliver protons inside the patient. This is, from my point of view, much more better than previous technologies like passive scattering, because this technology allows us to achieve much more better dose distribution inside the patient. That's one important thing. Second, previous methods of proton beam didn't allow us to change treatment plans during the treatment. That's so-called adaptive approach, and pencil beam scanning allows it. This leads, this open many new indications for proton beam where the adaptive approach is necessary, and which could not be treated before pencil beam scanning. We started with some simple diagnoses like prostate cancer or some brain tumors. And during the time, we developed approaches for more complicated diagnosis. As example, one of these are head and neck cancer, because these are very comprehensive and big target volumes, which are changing during the treatment. So that's one diagnosis where the adaptive approach is really necessary, and we developed some procedures how to manage head and neck cancers during the whole treatment to have reproducible and proper dose delivery. Another example which we started 2 years ago are moving targets, tumors inside the chest, like malignant lymphomas malignant lymphomas. And we started with some technology of motion management, which depends on irradiation in deep respiration breath hold, when the structures inside the thorax are stopping in movement, and the beam is gated and beam is on only during the stopping phase of breathing. So that's another example. And the last diagnosis which we started was breast cancer, when we combined this irradiation in deep respiration breath hold with some technology for detection of surface with stereotactic cameras, which allow us to very precisely set up reproduce position of patient for this radiation. All centers are going the same way. That number of diagnoses is growing. Proton therapy isn't limited for skull-based tumor as in the past, but there is a lot of new diagnoses like head and neck, and like lymphomas, like breast, like pediatric. My opinion is that proton therapy will take more and more patients and will take some part of radiation oncology. I'm not sure how big this part will be. I suppose that it may be 30–40% of this. And I'm sure that technology will be cheaper and cheaper. Treatment also, because there is a trend to do some accelerated radiotherapy, not so long as in photon world. And well, that will be standard. During the few years, I think that it will be standard part of radiation therapy.